It's one of the toughest decisions a family can make. When is it time to call hospice? As hard as it is to talk about, hospice care can alleviate some of the stress the disease process brings. But maybe you or a loved one are facing a terminal illness, but not quite ready to give up on treatment. Well, there's another option called palliative care. Have a look. Joining us now here at Lakeside Manor is Kathy Baldridge. She's a registered nurse with Infinity Hospice Care. Kathy, I want to ask you, because it's kind of a fancy medical word, palliative care. Break it down for us.
Palliative care is the chronic management of life-limiting illnesses that a patient might have.
And it's kind of a precursor to hospice in a way for some people?
It can be, yes.
And so when you go into palliative care, what exactly do you get? What does that mean?
In palliative care, you have a physician and social workers that will come into the home and help create an individualized plan of care for the patient.
But not all people that go on palliative care go on hospice?
No.
And why is that?
Some people coming home from the hospital that go into palliative care are maybe in the earlier stages of their disease process, and they need help learning and understanding their disease process and how to manage that at home. And then they return to their regular life off from palliative care at that point, and maybe they come back later into the palliative care program as their disease process exacerbates.
So what would you say family members or patients themselves would say about it? Does it lessen their stress? Does it make sure they don't get to have to go to the hospital all the time? What are some of the benefits?
Correct. That's exactly the benefit of palliative care, is to help patients be able to remain in their home and manage their care themselves at home, and to understand their disease process and their medications and how to treat those symptoms as they rise.
That's huge, being able to stay at home, not have to worry as much about getting to the hospital. You have your own physician, you said, right? You get
Correct.
One. That's amazing. Through the Medicare program, which is
Correct.
great. Medicare pays for it.
Yes.
What are some of the most common diseases you say people on palliative care have?
Some of the most common diseases are like COPD, congestive heart failure, Alzheimer's, other dementia-related diseases, ALS, renal kidney diseases, diabetes, any chronic illness that can have life-limiting capacity.
Now, we mentioned this can be a precursor to hospice. What are the main differences between a palliative care patient and a hospice patient?
A hospice patient is a patient that's entered the end stages of life, and they have been diagnosed or prognosed to have 6 months or less left to live in their disease process.
And with hospice, there's even more benefits than palliative care.
Correct.
Because it's kind of the big brother of palliative care in a way.
Right. With hospice, you have physicians and social workers just like you do in palliative care, but you also have the benefit of nurse practitioners and registered nurses, LPNs, volunteers, social worker again, and your spiritual care.
Right. And when is it time to call? Let's say someone is watching and maybe considering palliative care or hospice. When is a good time to call?
The good time to call is, whenever you have any type of a life-limiting illness and you're struggling with that chronic care management and you need a little help in the home. Maybe it's gotten more difficult to be able to go out to the hospital or their doctor's appointments, or they're having more increased hospital visits. That would be a time to consider palliative care.
Absolutely. I think a lot of people are scared of the word hospice, and now maybe they're a little scared of the word palliative care. I hope not. I hope this eases any tension, but it can be a really good thing because you're at home, you get the care that you need, really concierge in a lot of ways.
Right, and can help decrease the hospital trips and admissions to the hospital. They can manage that disease process at home. And
their family members, I'm sure you guys help a lot of families too.
Correct.
In this process.
Correct, yes. Education and counseling is also provided for the families and the caregivers for the patients.
And because you're actually caring for them in a lot of ways, where it might lessen the stress of a family member too.
Correct.
Right.
Yes.
Great, Kathy. Thank you so much for coming on the show. Appreciate it.
Thank you.
Aging and Awesome is brought to you by Infinity Hospice Care, family owned and operated, serving Nevada for over 10 years. They provide dedicated, compassionate, expert care for your loved ones. Visit infinityhospicecare.com today.